Hello, everyone. My name is Christine Ryan. I'm a family physician in Shellbrook. This project was born out of a critical incident, as well as my own experience with lack of information for patients and their families about what is available around palliative and end-of-life care. We started with developing a patient questionnaire and found that a standardized resource or information package was much desired. Additionally, we talked to other areas to see what was or was not working, and from this, we came up with our aim statement. The basic tenet was to create a resource that was created by patients for patients. And although that was my project, I learned much more during my time in CQIP. I've changed the way I present project ideas, as for some people, data is needed. Others are more affected by a specific patient story, and that's what will motivate them to help you with the change. Part of the course taught us about listening to our critics and skeptics, as they may actually be change people. For us, several of them actually ended up being major contributors. I've also changed some of my work when it comes to asking patients about what they want and using the ideas around humble inquiry and working on my own attitudes to ensure that mine is a non-defensive interaction when I'm discussing patients' own experiences. Additionally, I began using driver diagrams and run charts earlier on as part of our process, and not just as something at the end for presentation purposes, as which they seem to be used on the hospital walls before I was part of this project. I found it actually changes my framework for thinking about the project. Overall, the CQIP learning experience and project was very positive. However, it was not without its challenges. I was amazed at the amount of time, admin time specifically, it took to arrange meetings in a rural area. I found that when talking to other areas about what they were doing, there seems to be a problem of us working in silos. Often we're duplicating work, and good work done in some areas was not readily available for others to use. Another challenge is that getting data for certain projects is harder than it seems. For mine, palliative care is surprisingly something we don't track, so the data collection had to actually start right from scratch. And with that, I found that balancing including patients in data collection and resource development against being pushy with vulnerable patients, a difficult thing to balance. Those patients with whom I often wanted feedback from or wanted their opinions of were the hardest to get a hold of. Going forward, my project and CQIP learning does not stop here. I want to continue to focus on my why as well as the why of my project. I'd like to continue building relationships with senior management to help spread this and future ideas and prevent the silo effect that was noted in this project. I hope to use some of my upcoming leaves to become more familiar with the data software programs, as I actually found them surprisingly useful and very powerful. And lastly, I'd like to continue to review and work on how to successfully run meetings. Surprisingly poor, skill I have, and especially the time management pieces and conflict management. Thank you.